Hey everyone, it's Crystal here at the AAFE Training Center, and today I am doing a quick neurotoxin treatment. This is a patient who I have been seeing for a few years now, and she typically comes, I would say, twice a year for neurotoxin. She's someone that can get away with going in between her appointments a little bit longer. As you can see, her muscle movement isn't too extreme or crazy. So we do an appropriate dose on her every, I would say, 4 to 6 months, kind of just depending. She normally tries to plan it around special events or occasions like vacation and stuff like that. And she is getting ready to go on vacation here soon. So she wanted to come in and get a little touch up. So as you can see, we're kind of doing full face, frontalis, glabella, crow's feet, a little bit of a brow lift because she does complain about her hooded eyes and the heaviness of her eyelids. And then lower face wise, we typically always treat her mentalis and her DAOs. So you can see I'm going pretty far up into the hairline only because she still had some movement there. And I hate when people don't inject all the way up there. And then, when it's all kicked in at the 2 weeks and the patient's raising their eyebrows, they have those weird little lines way up close to their hairline because that part of the muscle is still active and it's recruiting. So I try to go as close to the hairline as possible just to ensure patients don't get those weird little lines. And just evenly treating all the way across from lateral border to lateral border to ensure she is not going to get any kind of spocking. Next, going into the glabella area. So doing my standard 5 injections and making sure that I'm always isolating that muscle. I am using a tight dilution here. It's my favorite way to inject neurotoxin. I used to use standard dilution a lot in the past, but recently I've been using tight dilution, and I think that it kind of changes the game in terms of injection. You don't have to worry as much about, complications because you're not worried about the product spreading too much or anything like that. So treating both her crow's feet now, they're pretty symmetrical. She doesn't have crazy crow's feet, so I just do a minimal dose on either side. But what does bother her are her hooded eyebrows or her hooded lid. So I'm doing a little bit of a brow lift. So you can see going into that superior lateral aspect of the orbicularis oculi muscle and making sure my injection is staying very superficial to ensure I'm missing the frontalis. And this will give her a little bit of a lift to the brow. Next, coming in and doing her mentalis. Keeping those injections as medial as possible because I never want to catch that DLI. And same thing with the DAO, staying as far away from the DLI as possible. And this is going to help pick up the corners of the mouth. And that is it. We will get her all cleaned off and ready to go. Her post-care instructions are to not touch for the next 4 hours and nothing that'll raise her body temperature for the next 4 hours. And we'll see her back in another 4 to 6 months. Thanks so much for watching, everyone.